So far, there has yet to be a drug or other treatment method that can rival the effects of Accutane on clearing your acne and keeping you clear over the long term. But there was a recent study that I'm going to evaluate today that could be changing all of that. We're going to dive into the effectiveness of these two therapies and the potential side effects. So what is this potential therapy that may give results similar to Accutane without the side effects? It's called 5-aminolevulinic acid with red light therapy. I'm going to explain the protocol, I'm going to talk about the effectiveness, and then we're going to compare that to Accutane because this particular study had two treatment arms. One of those arms treated patients with 5-ALA cream and red light therapy, and the other put them on a course of Accutane for 6 months. If you're not familiar with Accutane, it is essentially a synthetic form of vitamin A, and when you take it by mouth, it helps to shrink down the size of your oil glands, and it comes with a number of potential side effects. I believe those can be managed quite well under the care of a dermatologist, but some people do suffer throughout their course of Accutane, and other people have experienced long-term side effects. Accutane, on average, is going to be about 6 months of therapy. And in this particular study, patients took 0.5 milligrams per kilogram of Accutane for 6 months, and the goal was to get them to 90 milligrams of Accutane for every kilogram of body weight. Now, I'm going to discuss some of the limitations of that at the end of the video, but I just want you to be aware of how they were treating patients with Accutane. They were taking it every day at that dose, and by the end of 6 months, they were about 90 milligrams per kilogram of body weight. Now, the other arm of this treatment, patients were treated by applying a layer of 5-aminolevulinic acid cream to the skin. Let me tell you what happens with this cream. When you put this cream on the skin, what it does is it absorbs into the oil glands, and then it is converted into something called protoporphyrin IX. That's not that important to know, but what you should know about protoporphyrin IX is that it absorbs light at a specific wavelength. Hint, the red light is going to hit that wavelength, and it can shrink down the size of your oil glands when you do that. So patients were treated with a modified form of 5-ALA, PDT, or photodynamic therapy. The cream was put on the skin about 1 millimeter thick for 30 minutes before it was cleaned off the skin. It was done under occlusion, so patients would have a mask put on that was dark in color so that it wouldn't start absorbing any light right away, and that helps to push the cream into the skin a little bit better. Patients were then treated under the red light for 1 hour, and this was 633 nanometer red light therapy, and the strength of that was 150 joules per centimeter squared. This is not the same type of device that you can purchase over the counter, and you cannot get 5-ALA cream over the counter. So it's important to know those things. This is still an in-office treatment, but we're going to look at the efficacy and the potential side effects. Now, the patients with Accutane were treated for 6 months, but the patients who underwent the 5-ALA and photodynamic therapy were only treated with 5 sessions spaced 1 week apart. And so patients had a treatment at week 0, 1, 2, 3, and 4, and then they monitored their progress for 1 month, 2 months, 4 months, and 6 months to compare the efficacy of finishing a course of Accutane versus completing a course of 5-ALA and PDT. We're going to dive into the side effects now. So in the arm of the study where patients were treated with 5-ALA and modified PDT, there were 77 patients in that side, and there were 75 patients who took Accutane. They did their best in the study to match up the ages and the severity of acne and all of that so that the groups were as equal as could be, trying to control for all the confounding variables. They couldn't have had another therapy for acne for 4 months previous, including Accutane. So if they had been on Accutane recently, they were excluded from the study. When we look at the group that was treated with PDT, they had 15 people lost to follow-up. And what that means is they didn't come back for their appointment and they weren't able to contact them again. So we don't know what happened to them. But 15 people out of 77 is not great, but it's not awful either when it comes to running a study. Of the people that did complete the study, it's important to know that none of them quit the study due to adverse effects from the treatment. Although there was some discomfort during the treatment, nobody quit the study. They completed all 5 treatments and got through it. So there was a high number of people that completed the study versus started the study in the PDT group. When it comes to the Accutane treated group, there is a different story, however. As I mentioned, 75 patients started the study on the Accutane group, and only 4 of them were lost to follow-up, meaning they didn't come back for their appointment and they weren't able to contact them again. However, 32 patients withdrew from the study due to side effects from Accutane. And I can tell you that because I prescribe Accutane in my clinic every day, that is a fair number of people who will have side effects from Accutane. We don't have that many people that stop Accutane due to those side effects because we are very careful in setting expectations, preparing patients for the side effects, and helping them to get through them. I don't know from the study as it was written what kind of interventions they were offering patients to keep them in the study and to manage those side effects. My guess is that they weren't doing a lot, and that's why so many patients dropped out. When we look at the side effects for the photodynamic therapy with the cream, those patients most commonly had localized pain, redness, swelling, and some exudate, meaning a little oozing from the skin. But they were managed with cool compresses and other really minor interventions. And again, nobody stopped the study due to that discomfort. When it comes to Accutane, however, the most common side effects were skin and eye dryness. Some people got very chapped lips. There was some cases of GI upset and headaches, as well as joint pain and muscle aches. So those are pretty common with what we see in our clinic when patients are taking Accutane. But a lot of patients stop the study because of that. So that tells you right there that if this can approach the efficacy of Accutane, there's a lot less side effects that you'll have to deal with. Now let's dive into the results. You're going to see some charts come up on the screen, and what we see is that patients who are in the PDT group got significantly better within 2 weeks. So with just 2 or 3 treatments, they were seeing significant reduction in the number of acne lesions. That progress continued through 5 treatments and then maintained pretty well, but got slightly better from month 1 through 6 as they followed these patients after completing therapy. Patients treated with Accutane got a much slower start, which is the case that we see when we treat patients with isotretinoin or Accutane in the clinic. They really didn't start to see a lot of improvement until they'd been on the therapy for about 2 months. It takes a little time for this to accumulate in the body, start to reduce the size and activity of those oil glands, so progress is a little bit more slow when you're taking Accutane. So it's possible that if you need to get really clear in a short period of time, the photodynamic therapy could be a better option for you. When they completed the study, they looked at patients 1 month after they had finished either Accutane or the photodynamic therapy, and in that group they saw that patients treated with Accutane had a significantly better outcome at that point in time. Meaning we see if we look at these lines, the Accutane treated group has a lot higher level of clearance than the group treated with photodynamic therapy. However, when we follow those patients out to month 2, 4, and 6, we see that those lines converge a lot more, so that at month 4 and month 6 after therapy, the results are essentially the same. So if you can have fewer side effects and get just as clear at 6 months with photodynamic therapy, does this make the 5-ALA PDT an Accutane killer? Maybe, but here's my opinion on the matter. First off, we need a larger study. This is a very promising pilot study, but with a larger study and more patients, I think we'll get better data. Plus, it may give us the opportunity to look at different protocols for the ALA and PDT group versus Accutane. So it may be that 5 treatments that they did 1 week apart is the best protocol, but maybe there's another protocol that would give even better clearance. Maybe these patients need to come back and do this every 1 to 3 months in order to maintain the really highest levels of clearance. So there's a lot of things we still have to learn about this. The other thing is that Accutane is often covered by insurance, whereas photodynamic therapy is not necessarily covered by insurance. Hopefully, if this becomes a more mainstream treatment, it will be something that could be covered by insurance. Now, when we have other devices on the market today, there's an AviClear laser and a Cure as a laser that treat the sebaceous glands and are specifically targeted to treat acne. Those things we know already are not covered by insurance, so they are an out-of-pocket expense. But if you are just not a candidate for Accutane because of side effects or because of some other objection that you have, which is reasonable, then paying out of pocket for these may be worthwhile for you. The other thing that I noticed in the Accutane treated group is that they were only treating to 90 milligrams per kilogram. In the United States, it's commonly accepted that patients need to be treated with higher doses of Accutane, meaning they need to get to at least 120 to 150 milligrams per kilogram of Accutane. So to go back to our 50 kilogram patient, in this study, they would have received 4,500 milligrams of Accutane, but in my clinic, we always treat to at least 150 milligrams per kilogram. That would be 7,500 milligrams of Accutane. So that's almost twice the dose. There's also been data that has come out over the last few years that if you treat patients with Accutane to a dose of 220 milligrams per kilogram, they get an even better result and they maintain clearance longer. So I think that we need to compare the results of photodynamic therapy to what is commonly the standard of practice in treating with Accutane, which would be closer to that 150 milligrams per kilogram of Accutane and sometimes even higher. Overall, however, this does appear that it could become a significant challenger to Accutane in the right patient who wants to avoid side effects or experienced side effects while they were taking Accutane, and it certainly has me reconsidering whether I would bring on red light therapy to my practice, because I have held off so far because there just hasn't been data to support that it's really going to give us the types of results that we see with Accutane. So what do you guys think about this study, and would you consider photodynamic therapy versus Accutane? If you've taken Accutane, what was your experience? Let me know down in the comments. I think that Accutane can be a good drug, but I'm pretty optimistic about the potential for photodynamic therapy in the right patient population. Hopefully you guys enjoyed this video and learned something from it. Share it with somebody who could use it, and I'll see you guys on the next video.